Thank you very much, Chairman Alexander, and thank you to all of our colleagues for being here today. Mr. Azar, thank you and your family for being here and your willingness to serve. In November of 2016, people started emailing me and calling, coming up to me in the grocery store and everywhere else with tears in their eyes, wondering what the future held, especially for their health care. And it hasn't stopped. And because these worries and challenges are what this Congress and the Department we're discussing today is supposed to be focused on, I'm going to start my remarks with a few examples of the stories I've been told over the last year. My constituent, Julie from Mercer Island, is a 4-time cancer survivor. She has said she would not be able to afford her medical expenses or even stay alive without Affordable Care Act protections. Kim from Ellensburg shared her story about her addiction to opioids and her ability to overcome it with the right comprehensive treatment. Christina from Marysville said that before going to Planned Parenthood, she struggled to get birth control regularly, given her unpredictable schedule in the fast food industry. Those are just a couple examples. There are many others, and so many pressing health problems this administration could be solving. But it appears that instead of solving problems, the Department of Health and Human Services under President Trump so far has been determined to create problems. The department has not attempted to help people get high-quality, affordable coverage. They made it harder by stopping payments for out-of-pocket cost reductions, by letting insurers cover fewer benefits, by cutting this year's open enrollment period, and slashing funding for consumer outreach and a lot more. Rather than allowing women to make their own health care choices, the department has tried at every turn to impose right-wing ideology on women and even prevent them from getting care from a provider that they trust. President Trump went to states like New Hampshire and Ohio and said he would confront the opioid epidemic head-on and called it a tremendous problem. People believed that he would make sure hard-hit communities get the resources that they need. But this administration and its health department did the opposite. It proposed gutting Medicaid, which offers critical wraparound services and substance use disorder treatment to people who otherwise could not afford it. Experts say that would cripple response efforts, and all it took was a meeting with a few pharmaceutical executives for President Trump to go dark on the skyrocketing costs of prescription drugs, despite the president's promises about bringing prices down. In fact, it's hard to find a health care problem the leadership at HHS has not only failed to address so far, but actively made worse. The department has proposed using public health funds to close near-term budget caps rather than to prevent costly illness and disease down the road, and utterly failed to see the urgency of the public health crisis that is still unfolding today in Puerto Rico and the U.S. Virgin Islands in the wake of Hurricane Maria. The administration is even rolling back protections that prevent discrimination against people who have historically been denied equal access to health care. It shouldn't have to be said, but the absolute last thing our nation's health department should be spending time on is encouraging more discrimination in our health care system. That is wrong. Now, Mr. Azar, you and I do have some stark disagreements, but your nomination still could be an opportunity for HHS to reset, to put aside the extreme politics that are actively endangering people nationwide and start focusing on the department's mission instead of President Trump's ideological agenda. People across the country would be far better off if you took this opportunity. But, Mr. Azar, I have to say with concern that my review of your record leaves me with serious doubts that you will. You know, as a pharmaceutical executive, you raise drug prices year after year. Eli Lilly, as we know, is currently under investigation for working under your tenure with other drug companies to needlessly raise the price of insulin. And you have said many times you oppose government efforts to lower drug prices. You've also made it clear on questions of women's health. You side with ideology over science and right-wing politicians over women. Although conservative experts and governors and even some members of Congress have rejected President Trump's attempts to sabotage the health care system and jam Trump care through, you said this legislation would have spiked premiums, undermined protections for people with pre-existing conditions, gutted Medicaid, cost tens of millions of people their health care, defunded Planned Parenthood, and more. You said it didn't go far enough. Mr. Azar, this leaves me very concerned about whether you would faithfully implement the bipartisan agreement that Chairman Alexander just talked about with us, that we reached earlier this year, should it become law. And finally, in light of President Trump's profoundly underwhelming follow-through on his campaign promises about tackling the opioid epidemic, it is deeply disappointing that yet another nominee for the role of Secretary of Health hasn't supported committing the new resources we need for this effort. So, Mr. Azar, I worry about your professional history and statements that point to a continuation of some of the extreme, damaging, and political driven approaches we've seen so far from this administration. So let me just return briefly to the stories I mentioned at the beginning of my remarks to make my final point. Right now, Julie is traveling around the country raising awareness about open enrollment to help more people sign up and get access. Kim is now pursuing a master's in social work and helping people in Central Washington to get the necessary treatment and services so they can overcome their addiction. Christina has become a vocal advocate for helping women in Washington and actually nationwide to get care that works for their needs. Julie, Kim, and Christina are doing more than their part to keep our communities healthy and well. So my question is, why isn't our nation's health department doing the same? People should have a Secretary of Health who will work for and with patients and families, not against them, and who is committed to making policy based on science, not ideology. So, Mr. Azar, I am looking forward to your thoughts on the many serious concerns I've raised and how you would be appropriate choice for this position. I am concerned that President Trump has yet sent us an extreme ideological-driven nominee to pick up where Secretary Price has left off, and that women and children and seniors and families deserve a lot better. So I am interested in your responses today. I hope I am pleasantly surprised. And I do want to say, if you are confirmed, I want to make it very clear, I have not and will not let this administration's approach so far lower my expectations for any of the departments this committee oversees, and I will continue doing everything I can to hold HHS to the highest possible standards of ethics and service for people in my state and across the country. With that, thank you very much for being here, and I will turn it back over.